Hey everyone, it's Trevor with Peak Potential Physiotherapy and Wellness here. Going live again to discuss one of our blogs that we had at the beginning of this week. Again, I'm Trevor with Peak Potential Physiotherapy and Wellness here in Collierville, Tennessee. We've been in the area for a little over a year now, and I've been practicing as a physical therapist for over 11, 12 years now. So what I wanted to go over today, and please don't hesitate to comment and put questions in the live chat or as we go along here. But I'm going to be discussing the blog that was posted about discovering the difference between a herniated disc and a bulging disc. Everyone has heard these terms before, but what the heck are they? I mean, everyone's got their own opinion. There's different physical therapists that say different things. There's also different physicians that'll tell you different things. So what I want to do is explain to you what a disc is what it does, how to possibly how to treat them, and also just some misconceptions and myths that go along. So again, if you have any questions, please comment in the comments, and then also you can put the comments down below, and I can address those later as well. So discover the difference between a herniated disc and a bulging disc. I guess who hasn't heard those terms? I mean, I've even been told that I have those things. But what is a disc? A disc is basically the cushion between the blocks in our spine, okay? So you can use the term vertebrae, but to break it down, make it simplistic as possible, we have these blocks that stack up in our spine, and we have a disc between each one that is the cushion, okay? So we're going to go over just like what those do, as well as what happens over the course of time. Everyone has degeneration in their spine, okay? And how that occurs is over time gravity kind of compresses us, and that gives pressure to the disc. I'm going to explain what the disc actually looks like here in a second, but please feel free to ask me as we go along. So a little test that I like to tell people is when you get in your car at the beginning of the day, you usually adjust your rear view mirror. And throughout the day, we have gravity affect us. And you might go to work and you're sitting at the desk, or you might go into your job and you're doing activity. And so what happens is, then you get back in your car at the end of the day, and what inevitably has to happen, that rear view mirror gets adjusted down. And what's going on there is that gravity has compressed our spine over the day. People always say, you know, who are older say, oh, I was 2 or 3 inches taller when I was younger. And it is true. We lose the fluid that's within those discs. So what happens when you have to adjust that mirror down is not only has our posture gotten worse and you've slumped down, but even if you sit up tall, you still have to adjust that mirror slightly because we've lost the pressure or the cushion in those discs, or in those cushions between the vertebrae. That's also why if you have a disc injury, sometimes you might have more pain in the morning, because after you've been lying down for the whole night, the discs get rehydrated, and they tend to increase in their height, okay? And then you stand up and gravity pushes down against them again, okay? So what's the difference between a bulge and a herniation? There are definitely differences between the two. So hopefully you don't mind my drawing of it, and then I'll show you kind of on a model too, if you don't mind. But it looks like something like that. And the way we equate it is called a jelly donut, okay? So you have in the middle what is considered the jelly, and then outside of it is a thicker, more cartilage type material. So a disc bulge is when the jelly pushes out into the rings like that. Hopefully y'all can see that. So it pushes out. Now that can cause pain. that can also just be irritation because there's nerves that innervate the outside or that are in contact with the outside here. Now, a true herniation is then that jelly starts pushing out against the outside. That can be a bulge. So the true herniation is that jelly actually comes outside of the spine like that, and that's where it can actually be more surgical, as if it herniates outside of the rings or the disc itself. So the bulge can be outside of that too, just not breaking that. Okay, I know it's pretty rudimentary, but basically a bulge is it's still within the ring. A herniation is it comes outside of that ring. And you've probably heard the term slipped disc. The disc cannot slip. It is held in the spine with ligaments. So the slipped disc does not happen. It bulges or it herniates outside of the ring, but it does not slip out of place. It can shift. So there's differences in your neck versus your lower back. So the neck kind of shifts, but it still doesn't slip out of place. It just kind of gets pushed onto the nerve, and that's where pain occurs. Okay? So a bulge is still confined within the disc, but kind of pushes out, and it usually pushes out to the back where it hits on one of the nerves. That can cause pain in the back. It can also cause pain down the leg. So you can term it sciatica, you can term it, there's a bunch of other terms that we use, radiculopathy, referred pain, and that's the thing, is that the disc might not be the pain generator. It could be the nerve, it could be the muscle, it could be the joint that the nerve is pushing on, and I'll show you on the other model here in a second. So one is that the disc bulge it's within the ring and kind of just pushes out still within the ring. The disc herniation is when the jelly comes outside of the ring, and that's within the spinal cord area, which is usually surgical. But a lot of times, if it hasn't gone very far, it can get resorbed and pushed back in. So that's some of the treatments that can occur with that. Okay, so just again to review, this is your spine. Your vertebrae are those blocks, that's the bone supporting each one, and then the discs are inside of it, like that. So that's representing the disc, okay? So the disc, the nerve, and the joint, I don't know if y'all can see that very well, but being right there, they're all within very close proximity of one another. We actually say about a millimeter of space. So you have to think if there's any pressure there, all of them are going to get irritated. What is the pain generator? So if you've been told that you have sciatica, if you've been told you have disc degeneration, if you've been told you have a disc injury, it depends on what's going on. Because again, the pain generator might not be the disc. So it could be the joint, it could be the nerve, it could be the muscle around that, and that's where you have to make sure that a health professional can assess that and see what is going on. Hey, Dean, all the way from South Carolina, right? So you have to see a health professional, physical therapy, chiropractic, anything like that. Because the problem is that when you get imaging, you will have people say, yes, you have disc degeneration, you have other things going on, which are the problems. And so I'm going to try to make sure I get my numbers right here, but there's some older studies that I remember in my head. You go and get an MRI or CT scan. CT scans are for the bones to see what's going on there. They do show some discs as well, but then an MRI shows a disc problem. The understanding that I have is that you have what's called a 70% false positive on that. So to make it in terms that I can understand is that if I took 10 people off the street and none of them had back pain and they had an MRI, 7 of them would have a disc injury. That could be degeneration, it could be a disc bulge, it could be a disc herniation. but none of them have problems with their back. So that's pretty scary. A recent study out that's part of our blog, let's see if I can pull this out. So they took a study that was performed with 60-year-olds, and none of them had symptoms or back pain. 36% had a herniated disc, and 90% had degeneration or a bulging disc. So, I preach it how I can, Dean. I appreciate you watching. So that means that out of the 60-year-olds that were tested, 90% had a disc degeneration or a disc bulge, and almost 40% had a disc herniation. None of them had pain. That's scary. I really don't want to see my MRI. I tell people this all the time. Poor nutrition, just being hard on yourself throughout your life. Anyone over the age of 30 will have disc degeneration. If I saw my MRI, I would be scared. So this is even part of the mindset. I have patients come in all the time. I had someone just yesterday who said, yeah, I have a disc injury. And I asked them, well, how long ago were you diagnosed with that? Or were you told that by a doctor? Well, they took an x-ray, which again doesn't show the disc itself, and they told me that about 20 years ago, and you're still having back problems. And they're saying, yeah, but I have a disc injury. By the time it's gone that long, the disc has healed itself. Now you're dealing with other pain generators, the nerve, the joint, the muscle. Your movement itself has been limited because of having pain from the initial disc injury. But that is probably not the problem you're coming in with. Pain is usually the problem, but it's what's it limiting you from doing is the main problem. So that's when seeing someone, a health practitioner, a physical therapist, who are trained in movement patterns to differentiate, is it a disc, is it a nerve, is it a joint? We can figure those things out through our examination. And then with our skill set is then help you get back to the things you want to be doing. In that regards, pain decreases as well. But we want you to achieve what you want to get back to. Is it being able to play with your grandkids? Is it being able to walk or run or perform your CrossFit or exercise routine? All those things you have to take into account. And you can work with even if you have a disc injury, degeneration, bulging, or herniation. It all depends on how you've been treated as you go along. Okay, so again, I'm going to link to our blog post under this video. And if you have any questions, please feel free to comment or ask me. There's also some links in our blog to a free report that'll give you some tips on things that you can do on your own. And then also if you wanted to contact us, you can respond in the comments. You can also get on, when you download that free report, you can send me an email. I answer all those personally. But it's been great getting to talk to you. I'm glad I got to shout out to one of my buddies out in the Carolinas there. I hope it's South Carolina there, Dean. But I appreciate all your support, and please feel free to comment or question me as we go along. So here's to seeing y'all next week, and have a great rest of the week. Thanks.